Hello everyone, my name is Mcastro. My community health promotion presentation is in infant and maternal mortality in Sierra Leone, Africa. Infant mortality is the death of infants before his or her first birthday. The infant mortality is the number of infants' deaths for every 1,000 live births. According to the World Health Organization states, the infant mortality rate has decreased from an estimate rate of 60.8 deaths per 1,000 live births in 1990 to 30.5 deaths per 1,000 live births in 2015. Annual infants' deaths have declined from 8.8 million in 1990 to 4.2 in 2015. Maternal death is the death of a woman while pregnant or within 42 of termination of pregnancy, irrespective of the duration and site of pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from the accidental or incidental cause. Sierra Leone has a population of 7 million people. Its largest city, chief port, and capital are Freetown. The town is situated in the northwest of the country at the coast of North Atlantic Ocean. Sierra Leone has a life expectancy of 45 years old. Infant mortality rate is 87 per 1,000 live births. The under 5 mortality rate is 120 per 1,000 live births, and maternal mortality ratio is 1,350 per 100,000 births. Fertility rates are high due to low contraceptive prevalence rates, therefore resulting in that Sierra Leone has the highest infant mortality rate. 1/4 of the population has access to safe and clean water. The strength of health system is the significance of the community health. This project supports the Millennium Developmental Goal in reducing child mortality and improve maternal health. Focus on mothers and their infants has increased significantly with the Millennium Declaration and the related Millennium Developmental Goal in 2000, in which it resulted in national policy and strategies. Furthermore, building on existing health policy and plans, Sierra Leone has recently prepared a strategy with a specific focus on maternal, newborn, child health, primarily to reach the Millennium Developmental Goal that targets with its particular attention to reduce child mortality and improve maternal health. The global under 5 mortality rate has declined more than half, dropping from 90 to 43 deaths per 1,000 live births between 1990 and 2015. Despite on the population growth in the developing regions, the number of deaths of children under 5 has declined from 12.7 million in 1990 to almost 6 million in 2015 globally. The Millennium Developmental Goal describes that in 2015 there was an increase of 70% of births that were assisted by skilled health personnel, as opposed to 1990s, the percentage was 59%. Since 1990, the maternal mortality ratio has declined by 45% worldwide, and most of the reduction has occurred since 2000. The plan for assessing learning are as follows. Increase the number of deliveries by skilled birth attendants at the health facilities. Improve access and quality of maternal and infant care. Minimize socioeconomic inequities in infant and maternal health. Increase demand for infant and maternal care, and improve service in difficult to reach areas. Socio-ecological model is a theory for understanding the multifaceted and interactive effects of personal and environmental factors. Socio-ecological model characterize certain core assumptions about human health and the developmental strategies to promote individual and collective well-being. This model will serve as a template to develop interventions addressing complex public health issues. Educational intervention can increase the effectiveness by attending the multiple level of the socio-ecological model, especially when implementing such interventions with minority subpopulations using sabotage reducing approach to reduce the risk of infant maternal mortality may be one way to account for multiple influences. The science and practice of minimizing mother and infant mortality can be advanced by using this model. The goal is strengthening health system for adequate provision of infant and maternal service. Strengthening health system can be accomplished by establishing leadership and governance, moreover, ensuring the delivery of the infant and maternal services. Furthermore, providing the community with the access to the necessary infant medications, vaccine, equipment, and supplies. The following behavioral objectives can emphasize educational plan to strengthen the health system, such as emphasizing collective efficiency and empowerment to create enabling environments. Moreover, emphasizing the public and private dialogue to change behavior on large scale, including norms and structural inequalities. Lastly, focusing on individual knowledge, attitudes, and motivation, self-efficacy, skill building, and behavioral change. Strategies to increase demand for maternal health services in resource-limited settings. Challenges to be addressed. It's an evidence-based practice article that suggests 3 problems that can be solved in contemplation of creating supportive environment, therefore improving maternal health services. Another evidence-based practice article that was used in establishing teaching plan was the global, regional, and national levels of maternity mortality. This evidence-based practice is a systemic analysis that provides a sustainable developmental goal that can be used to assess the progress towards reducing maternal mortality. Lastly, strategy for reducing maternal mortality, getting on with that works, is an evidence-based article that provides strategies that could potentially reduce maternal mortality. To conclude, it's essential to reduce infant and maternal mortality by further educating individuals in Sierra Leone. For instance, creating a future plan that can appropriately train and teaching the birth attendants of the aseptic techniques that can be used while attending pregnant women. Providing proper vaccination and family planning can potentially reduce infant and maternal mortality.